Good morning, everybody. I bring also some energy here, and what I would like to start with first is a little show of hands, because you've been sitting here quite a little long, and I know that I stand between you and the break and the breakout sessions. So first show of hands, how many urologists do we have in the room here? And where are you located? Great. And how many practice administrators? Okay, wonderful. You're all co-mingling, that's great. And then also research. Who is involved in research here? Okay, sparsely show of hands. Wonderful, thank you very much. So as I was born, raised and educated in Germany, trained as an engineer, and I'm reminded here as I was listening to Dr. Beeson that I looked at the agenda and I'm your first non-physician here. And I think that's a great thing, because as Albert Einstein said, the problems that exist in the world today cannot be solved by the same level of thinking that created them. So being able to take input from the outside and look beyond, that is one of my favorite definitions of innovation. Innovation is taking what works in other industries, in other practices, and making it work for you. And I think that's one of the choices or one of the inputs that led to making telehealth a theme here for this conference. After this talk here, I have a couple of breakout sessions if you want to learn a little bit more. So I'm very excited to share with you, and I know that we're running a little behind schedule. I need to find my pointer here and need to make sure that I can advance here. Great. So let's get started. As a good engineer, I'm very structured and I'm very organized, and so we're going to talk about 4 topics today: telehealth defined, applications in urology, then the obstacles and opportunities, and in the breakout session we'll go a little bit deeper here. So I am passionate about improving healthcare. When I got introduced to healthcare at the Mayo Clinic in the year 2000, I was appalled by what my profession, the software engineer profession, had done unto healthcare with the EMR. And I apologize for that, and I'm doing penance for that for however long I'm going to work for it. Because it was just shocking to me how you could apply wonderful technology in such a dismal way and really get into the way between the patients and the physicians. And so when I had an opportunity 6 years ago to venture out on my own, I looked at, okay, where can I make the biggest impact? And it's at the intersection of using technology to deliver healthcare where I have been working here the last years. And I'm very great that you're looking deeply into it. Last year you had the exam and the test in telehealth, from what I heard earlier. And so today we're going to plan the surgery. So here we are and planning the treatment plan, getting you ready to take the pill. Everybody agreed until somebody defined it. If you've been in any committee meetings, that's what usually happens. Everybody sits around the table. So I want to start with some definitions. Now, these definitions are not self-serving. I'm not presenting a research paper here. They are here with a very pragmatic reason. I want you to take these definitions, and on those iPads you can save the slides, send them home to you, use them as an inspiration of what that means for your organization. As Dr. Beeson just said, he presented a lot of general things and then something very specific to urology. But you need to make it your own. You need to find your own story. You need to find your own passion. And I'm providing here some tools, some guidelines, some definitions by which you can do that. The other thing that I want you to take away from this particular definition here is that telehealth, whatever notion you might have had, most of the people that I talk to, they think about a video chat, or they think about going on the web and signing up and having a little Skype call or things like that. But telehealth is so much more, and that's what I want to open your knowledge up to here, expand your knowledge. And the other term that gets thrown around, and I use them interchangeably, although they're subtly different, is telemedicine, which is practicing medicine at a distance. So these are interactions between a clinician and the patients, whereas delivering care at a distance, that can be patient engagement apps, that can be education, as you'll see on the next slide. I love taxonomies. I like to organize, put structure around it, because then I can take that information and plan it. And so here's a visual of that, those 2 terms, telehealth and telemedicine. We have telehealth breaking down to teleeducation, the patient portal, any interactions, and then telemedicine, which breaks down into interactive patient care. So that's interacting with the patient over video, over chat, Remote patient monitoring, that's the continuous monitoring or continual monitoring of vital signs, maybe post-surgical monitoring, chronic disease management. Also, I think there are great opportunities within urology, especially around the post-surgical follow-up, and then store and forward, the ability to have something recorded and share it with another specialist. And so this is a brainstorming tool for you to sit down and say, look, where in these 7 different areas do we have an opportunity? The definition of interactive patient care, go over quickly here. You can read it back when you're at the office, at your planning session, live video chat or phone interactions, remote patient monitoring, continuous and periodic transmission of vital signs, and then store and forward. If you don't know yet, RPM, I mean, obviously you can weight with a Bluetooth scale, you can do blood pressure, you can do glucose, you can do any kind, you can do pulse oximeter. Those are the 4 common also in COPD. So there's multiple tools available. The key is that it's automatic and that it's easy for the patients to do it continuously so that it's not cumbersome. And then store and forward is the asynchronous transmission of video, image, and sound. If you fax an EKG to a cardiologist, that is telemedicine. And so that's one way to look at that. And then the other definitions here, teleeducation, providing educational information, and patient portal, which for me is the term to just give patients access to their information, their record, their whatever they need access to, and that they maybe can take with them. The value of telehealth, and you may have heard a lot about that last year if you were here in the breakout session, because that's the basic, is improve patient satisfaction achieved through more interactions, easier access, more convenient access, better health outcomes through more interactions, and then also improve provider satisfaction and lower cost of care. The outside obviously is the triple aim, but I never bring up the triple aim without bringing the quadruple aim, because again, as I mentioned, when I started the Mayo Clinic, I was appalled by how frustrated physicians have gotten by the technology getting in the way. And one of my passions is to, through workflow design, through the redesign of how we want to deliver healthcare, how do we want to redesign our workflow so that everybody can practice on top of the license? And that's not just the physicians, that's the nurses, that's the APPs, that's everybody, so they can really do what they're passionate about, bringing back that calling, rediscovering that calling, so you can focus 80-90% of your day on doing what you really love doing. And that, as an engineer, for me, the solution there is simple. It's well, redesign the workflow and then implement it through technology. So improving provider satisfaction is a great opportunity. It does not come easy, it does not come automatic. You need to put very conscious effort to that, as Dr. Beeson kind of just outlined as well. But it is a very achievable goal, and it's something you need to put forward when you move forward here. So telehealth is about delivering care at a distance. It's about putting the patient in the center. It's about workflow design for physician efficiency and optimizing the delivery of care. But ultimately, it is about people. It's not about the technology. 10 years ago, I couldn't have stood here and well, first of all, you didn't have a LUGPA meeting. And it's amazing what, I was impressed with what you had accomplished at LUGPA, because it's amazing what we have as society experienced here in the last 10 years. 10 years ago, the iPhone came out in 2007. Facebook made its doors public. Twitter came out. Airbnb came out. I mean, all these different things. Amazon Web Services. IBM started their Watson project. I mean, you look at what happened just in the last 10 years. It's staggering. But now we have the technology that is easy and reliable and secure. And now we need to do something with it. We have the right tools now, but you got to do something about it. And it takes much more than just calling up a vendor, getting a fancy sales presentation, and signing up for a tool, because it's not about the tool at all. So what are some of the applications in urology here? On the left side, you see, I already mentioned those. Those are interactive patient care, remote patient monitoring. I want to bring another viewpoint to you to give you some more ideas of where are some business models, where are some service models that you can think about in your practice that make sense. And I call them outbound telemedicine. That's when you bring your expertise to the world, and to patients and to clinicians, to other clinicians, and then inbound telemedicine, where you're bringing expertise into your clinic and to your patients, and becoming therefore a one-stop shop. And so to put that as a chart here, again, we engineers love graphics and matrices and all of these things. So outbound telemedicine, so you can do it to patient. The patient can be in the hospital. Maybe once you admitted a patient, maybe you can follow up with the patient while they're still in the hospital. Technology would make that possible. They can be in a different clinic. Maybe you want to expand your geographic reach and you want to work with rural clinics who don't have access to urology. So how can you expand your revenue, not by adding more patients, but how can you add more patients without adding more facilities or even adding more staff if you do have capacity? And so you can go to clinics, go to nursing homes. Technology makes that now possible. You can think about applications in the work, school, or home environment here, follow-up visits with patients. And outbound telemedicine also means that you can share your expertise with other clinicians. You can have clinician-to-clinician consults. There may be opportunities there, again, and clinicians may be located in various different roles, and clinicians or care providers might also be nurses that are home nurses or school nurses or other applications that apply in your practice here. So the inbound telemedicine opportunities here, just to name a few, is when you bring expertise in. Maybe you consult, you do the e-consults with the AMCs, the academic medical centers, so Mayo Clinic, Cleveland Clinic. They are all offering by now access to their specialists. And so you want to confer with a different specialist that has a bearing on the disease condition for your patient. Now, I understand that's the role of the primary care physician, but sometimes patients right now are very selective of where they spend their healthcare dollars, and so if they have a urology problem and they come to see you, can you help them beyond what they currently have? Echoes is something you may look into. It's an opportunity to meet with others and to review cases from around the nations. And there's numerous echoes and different specialties that have been established. If you just Google telehealth and echo, you'll find a lot of information. Related specialties, can you bring in other specialties for other consults, make that a one-stop shop for your patients, and then pre-surgical and post-surgical consults and exams. Those are some other opportunities to, again, have the inbound telemedicine to take advantage of that. So that all sounds good, and okay, there are some interesting opportunities there, but some of you have looked into that, raising the question, yes, but what about the money? What about the regulations? And yes, you're absolutely right. We currently have four main barriers to success here. On the one side, we have the legal boundaries here. We have cross-state licensure, meaning that if you want to see a patient that is located in a different state, especially if you may be close to some other state lines and you're not licensed in that other state, by the current rules, you need to be licensed in the state where the patient is located. The state medical boards are still sometimes uneasy about allowing telehealth and telemedicine. That is changing rapidly here, and so there's those barriers are removed, and then there's also licensure compacts that are being formed. So look into your own area of in your own state of what's going on there. Financially, then obviously the reimbursement, but it's getting better by the minute. A lot of states have passed the parity law, which means that at the lowest level that commercial insurers must cover telehealth and telemedicine if they were to cover it if it was delivered in person. And so that's the parity law. Some of the better states have them also payment equity, so they have to pay the same and they cannot just discount it just because you're seeing them via telemedicine. And so that's with commercial insurers. Medicaid also in many states, over 30 now, or maybe close to 40 even, are now having opportunities to do telehealth and telemedicine and are really supporting it. Medicare has their hands tied by some statutes that were put into place in 2001, and they need an act of Congress, literally and figuratively, to get changed. And so they're trying to innovate around the fringes and are really trying hard to create opportunities for your Medicare patients to also reimburse for telehealth and telemedicine because they are now seeing the benefits. From a technical perspective, the barriers have gotten smaller over the years here. So we have reliability and security as one thing to always watch out for, and then usability and scalability. So can the solution that you use be used with multiple providers and multiple patients? So looking at that. And then the cultural changes, and that's what Dr. Beeson just talked about too, and I'm totally 100% behind it. It's all about organizational change management. You got to involve the people, you got to find your why, you got to find the passion, and you really got to manage the change. And it's not just the change on the side within your staff, but it's also you got to manage the change of the patients as well. A lot of direct-to-consumer telehealth services have been launched, paying $49 here, and then you can use our service, and the adoption rate has been very, very, very slow because nobody thought about how to engage the patients, how to let patients know, how to educate patients about the benefits, or even to ask them if that is what they wanted. And so a lot of times it's the vendors that are pushing those kind of services because they need to see the revenue to show a good balance sheet for their venture capital investors that have invested. I think this year we're on par to investing $8 billion into digital health, or venture capitalists, and so that's a huge investment and huge drive to make sales. And then you need to have implementation and support expertise. Don't rely just on the vendor, because the vendor does not typically understand your culture, and a lot of vendors still do not understand really healthcare and healthcare delivery. They understand IT and technology and sales, but they do not understand how physicians think and work, and how fragile and how important this patient-physician relationship really is. And so that's getting some expertise there is very key. And the other challenges here is that you always, for each service that you look at, is from a business development perspective, what is the business model? Can this be financially sustainable? Is this clinically efficacious? Is this really something that will help us to achieve better outcomes, lower the cost, whatever your metrics are? Maybe you are or can be part of an ACO. There's opportunities for other business models that we go into more detail here in the breakout session. And then obviously the scalability. I mean, you can have maybe one physician in one of your larger practices that is very excited about it, but can you really scale it? Can you roll it out across multiple physicians here? So here are the opportunities and the value and the benefits. So why are we worrying about telehealth and telemedicine now? Well, as I mentioned in the beginning here, a lot of things have happened in the past 10 years, and telehealth is here to stay. I firmly believe that in the next 10 years, if I tell somebody I have just seen my physician, that means I have seen my physician on some kind of screen, or maybe I even interacted with them over chat. And if I say I have gone into an office actually and I needed to find a parking space and go into the waiting room, that will be the exception. The technology is coming, and what has happened just technically here, technology-wise in the last 10 years is going to push into that. Consumers start expecting telehealth, and I'll go more detail here later. Virtual hospitals will increase. Mercy has created a virtual hospital on a green field. It's a hospital without beds. It's each morning there's hundreds of staff, physicians, and APPs that are streaming into this hospital, and they're providing telemedicine services and so Google Mercy Virtual Care. They've got a beautifully designed facility and a really nice promotional video, and they have been around for 5-6 years, and they're making strides and they're making progress. So virtual hospitals will increase. Within 10 years, over 80% of all interactions with healthcare will be virtual. Kaiser actually said 2 years ago that over 50% of their interactions with patients were virtual, and that included patient portal access or phone calls. And telehealth enables personalized care. That's also going to become more and more important as we now are shifting from a patient to a healthcare consumer. They're voting with their wallets, and so you need to really understand the patient of what they want and what they need. And telehealth enables that personalized care. Reimbursement and licensures are becoming more and more non-issues, and solutions will be more and more specialty optimized. And so there'll be special exam tools for telemedicine in urology. There are already in diabetes, in endocrinology, in other specialties, specialty exam tools. And the cost per visit, when you buy it right now, the technology are less than 50 cents. So the investment in technology is no longer the barrier. And the modern healthcare consumer is more prepared than ever. They're no longer willing to simply defer to the expertise of the doctor, and they're insistent on the reliability, quality care, and rapid access to service. So that has dramatically shifted. I'm sure that you have seen that in your practice, and you will see that more and more. Just bring that up here quickly, but a shift has happened here. 20 years ago, we started in finance with online banking, online training. Then 15 years ago, really commerce took off, e-commerce, online commerce. Amazon, Best Buy, JCPenney, you can order stuff online, you can have it delivered to home, anywhere. Uber and Lyft, Kayak, Expedia, Airbnb, 24/7 access to virtually everything, anything. And then communication, Facebook, Twitter, Snapchat, all of these tools that we really didn't have yet. That is happening, and that is shaping the expectations of the healthcare consumer. Again, turning them from a patient into a healthcare consumer. So what do the consumers desire? And Dr. Beeson talked to that. Well, first of all, they want quality. They want to make sure that, okay, yes, I have some good quality of care here. They want increasingly convenience. They want value, because now they're paying for it out of their own pocket. And they want to have confidence, which kind of goes hand in hand in quality, but they want to have confidence that they're getting a good care or the best care, depending on the severity of their disease or their symptoms. And so quality and confidence, that's where the academic medical centers live. Value and convenience, that's the online clinics, the retail clinics, the ones in the grocery store. Quality and convenience, a lot of people have tried out, and I think no good model has emerged yet for concierge medicine, where you pay an annual amount and then you have unlimited access to a physician. And then confidence and value, that is typically the trusted PCP. Quality is not that important. It's more important that I trust my primary care provider. And the leaders of tomorrow are going to have to live and address all four aspects, and telehealth can greatly help with that. And then large urology group practices, I think you currently live in the confidence and value, again, depending on your area of specialty, also in the quality, but really migrating towards the future leaders here of incorporating digital health abilities and really embracing the modern healthcare consumer and catering to their needs and their desires. So the value of telehealth offerings, you can expand beyond your current geographic boundaries, because you're no longer bound by the limitations of how far patients are willing to travel and how much advertising dollars, so to speak, you want to put into traditional. And so building up relationships with rural clinics, maybe in other cities. If you have a very deep knowledge in one subspecialty within urology, can you now amplify that? Can you make that accessible? That's one of the things that I've discovered with the physicians at the Mayo Clinic. Their calling was to really dive deep into one particular disease and to really become extremely proficient, and they wanted to see dozens and hundreds of patients in that area. And so telehealth now gives you that same ability. It levels the playing field. It gives you access to the patients nationwide. Give consumers what they expect, and then provide access to your unique expertise more broadly. So the benefits, timely access, easy access, continuity of care, and also care coordination. I think that's great to have a handoff, to have a face-to-face visit maybe with the primary care provider. It just has to be 90 seconds, but 85% of all communication is nonverbal. And so having a video, having me here live rather than me on screen or me just on a phone. I mean, what kind of a presentation would that be if I was just on a speakerphone here with some slides? It has a very different energy, and by the same token, you can have good care coordination here. And then from a business perspective, it provides you with a competitive advantage. It provides opportunities for work-life flexibility, because if you can see patients virtually in some scenarios for the care of some diseases, you don't have to necessarily work from the clinic environment. And so if somebody just wants to work 3 hours a day because maybe they're a stay-at-home parent, they could maybe still do that without having to come in to a clinic. You have an extended reach, and you can really specialize. And so there, from a business perspective, there's a great level of benefits. So what's the outlook here? What are the next steps? I invite you to attend one of the next 2 breakout sessions here. And then in that I will go deeper into defining your telehealth strategy, identifying your why, and developing your telehealth business plan, because launching into telehealth is akin to starting a new business. Then just go and do. Don't think too long. Just go and do. Conduct a proof of concept. Take one physician. Take one scenario. The technology is usually subscription basis, and so negotiate a small contract and just try and learn what works in your environment, and then start marketing and launching your first telehealth service. So that's kind of the roadmap. And with that, I hope that maybe we caught up a little bit on time here. And I have a table right outside the doors here. And we'll also, I think, take a 10-minute break, and then we'll have the breakout sessions here. And I'll be available also the rest of the afternoon. And thank you very much